All right, so for Chapter 5, Part C, we're going to look at a few of the diseases that can then be affected with our cardiovascular system. So cardiovascular disease is the most common cause of death in the Western world and has become increasingly more common. There are disorders of the blood vessels, and then there are disorders of the heart. And as we will see in Chapter 6, there later are disorders of blood. Disorders of the blood vessels include things like hypertension, atherosclerosis, strokes, heart attacks, and aneurysms. So we're going to work our way through these. Hypertension is when you have high blood pressure rates because the blood is moving through the vessels faster than normal. It is often the result of arterial plaque. And when we see arterial, we just know it's in the arteries. And plaque is actually quite similar to the plaque that you have on your teeth. It's a combination of different sugars and fats and molecules that just build up and just kind of sit wherever they're located. They don't actually do us any really sort of good. And because they're taking up space, it's really difficult for the blood to move around it, and so the pressure in that little narrowed spot, of course, is increased on the walls. And if we see that in a lot of places, it can happen, in more places throughout the body. So the actual numbers to consider it hypertension is having 140/90. And part of the problem with hypertension is that it's called a silent killer because there are relatively few symptoms. So hopefully you've been noticing every time you go to the doctor, pretty much no matter what it's for, they take your blood pressure. My optometrist recently started doing it too. So the good news is we are aware that it has some challenges, so as long as you're taking those numbers into consideration when you visit the doctor, that'll help. And hypertension can contribute to heart attacks, strokes, and kidney failure, so we do want to keep an eye on it. Atherosclerosis, very specifically, is just that buildup of plaque in blood vessels. So atherosclerosis can lead to hypertension, and this is what it might look like. So we actually have these little balls of fat, which is that plaque with a layer on top of it. And so what we've done is we've narrowed that lumen. If that plaque stays stationary, if it just stays in that wall right there, that's called a thrombus. But if that little chunk detaches and starts moving through your vessels, then we call it an embolus. And that becomes pretty dangerous because if that embolus can then move its way into a smaller blood vessel, right now in this blood vessel it's just partially blocking it, but if it moved into a smaller one, it could completely block it. And of course the challenge with completely blocking it is that then we wouldn't have any blood flow to that area. We wouldn't have any oxygen coming to that tissue, and that tissue could then die. So that's what would lead to a stroke, a heart attack, and possibly an aneurysm. Now, a stroke, what it actually is a cerebrovascular accident, which of course sounds fancy and scientific, but if we just think cerebro, brain, vascular, blood, accident, right, it wasn't on purpose, that's a stroke. So typically what's happening here is a cranial artery, so an artery serving the brain, is blocked, possibly from plaque, or it bursts. So in either of these, the blood flow is not getting to the brain, and there's a lack of oxygen to the brain, and that part of the brain dies. It does not take long for this to happen, which is partly why it's a little scary. And so that lack of oxygen leads to that tissue death, and that tissue in this case just happens to be the brain. Now, since the brain controls so many things, that's why this is pretty dangerous. Symptoms could include a numbness in your face or your hands, because those cranial arteries don't just serve the brain. Many of them will also serve your skin, and some of them actually branch and serve your arms, and because of the way the body's pain receptors work, they can actually indicate differences or challenges in other parts of the body when you feel pain in a different part. Difficulty speaking or an inability to see. If there was a sudden loss of hearing or a sudden loss of some other sense in your brain or in your head, that would also be a reason to go get it checked out, just because those nerves and those blood vessels are connected. A heart attack is officially a myocardial infarction, and it's the same thing as a stroke, just that it's with the heart instead of the brain. So again, we have a lack of oxygen, and again, the tissue is dying, and in this case, the tissue happens to be cardiac muscle. Sometimes there's a pain that radiates down the left arm, indicating a heart attack, and again, it has to do with the pain receptors and the location of the nerves and the development of the nerves in your body. So if someone does suddenly have a pain in their left arm, it's reason to take that very seriously and head to the doctor. And again, what's going on is we've got a blockage of a coronary artery instead of a cranial artery. Plaque or perhaps an aneurysm has occurred, and that plaque is blocking a little vessel, and that tissue doesn't have oxygen. An aneurysm is a ballooning of a blood vessel. So the blood vessel experiences often a high blood pressure, and so the blood vessel just starts to stretch and stretch and stretch out. It can't withstand all that blood pressure, and it balloons. So atherosclerosis and hypertension can weaken that vessel and lead to ballooning. And of course, if that vessel does burst, then that blood is no longer flowing through the vessel. It's now bleeding into, spreading into other parts of the body. So there are some various treatments for blood vessel diseases. Certainly if we know the cause is plaque, there are certain drugs that dissolve blood clots. So depending on your body and your doctor and your medical history, you could be prescribed drugs to try to dissolve the blood clots. The other thing that can happen is we can try to treat the arteries themselves. So we have a couple ways of doing this. Bypass surgery is when you actually take a vein, very often from a leg, a healthy vein, there's no plaque buildup in it, and then you actually just bypass the clogged artery. So in our image, this is where the vessel is blocked, right here. And so remember when we kind of drew that fake line earlier and we said we've got a connection down here, but any of the blood trying to come down here can't get through. It's just blocking up and backed up. So this tissue down here is not getting the nutrients that it needs. So what we've done with a bypass surgery, if we've taken this vein and we've just basically stitched it into the aorta so that the blood can just bypass and come down here and then serve all of this tissue effectively down here. So we're literally bypassing the clogged artery. And a triple or a quadruple just tells you how many bypasses, how many little veins you're stitching in. So in this picture, we have a triple bypass. A stent is a wire mesh cylinder that can be inserted into a clogged artery to hold it open. So that's what we see on the right. And an angioplasty does the same thing, but instead of being a mesh cylinder, it's a balloon. So you insert that into the clogged area and then you inflate it. And in this particular picture, they're using both of them together. But both of these are just forcing the blood vessel to stay open, even if there's plaque present. So those are all diseases of the blood vessels. We also have some disorders of the heart itself. And one of them is just heart failure. And this is when the heart is no longer pumping properly. So it's no longer contracting. We're no longer sending signals from the SA node at an appropriate timing to allow the heart to pump. So some treatments, depending on what type of heart failure you're experiencing, is a left ventricular assist device, and essentially it just pumps the blood for you. It's basically a heart replacement, and your blood is just a machine that you put in the body and it connects to your blood vessels. And a heart transplant can either be natural or artificial. Here we see an artificial one in this image to just replace that heart tissue. The best way to prevent cardiovascular disease, pretty much all of us know this, it's just that it builds up over time. It's degenerative. So it's hard sometimes to make these decisions or make these choices on a daily basis repeatedly. So avoiding tobacco, avoiding drugs, avoiding alcohol in excess, any of those things in excess, is of course good for other parts of your body too, but certainly helps prevent cardiovascular disease. Obesity, avoiding obesity, avoiding a sedentary lifestyle. Again, just getting up and walking for 30 minutes a day is really helpful, getting that blood flowing, using, the nutrients that you're eating to do something. A poor diet can contribute to this because diets that are poor, high in simple sugars, are very easy to convert for the body to convert into fat, and fat is a main part of plaque. Having a lot of stress, we've seen people who experience a lot of stress in their lives, which I know pretty much all of us feel stressed, right? We've taken classes, we've got jobs, we've got kids and family, and the car broke or whatever. So there's lots of stress. So trying to take time to be de-stressed is helpful in preventing cardiovascular disease. And then another great way of preventing it is to actually have good dental hygiene. So dental hygiene, the plaque on your teeth is the same as the plaque in your arteries for the most part. So if you don't get your teeth cleaned, if a piece of that plaque breaks off of your teeth and heads down, you swallow it and it heads into a blood vessel, or maybe you've got a cut in your mouth and it gets into a blood vessel that way, then you've got a little chunk of plaque that's already ready to go, and it's easy for that to build up once it's there. So keeping your teeth clean, keeping those hygienic appointments twice a year are really helpful to help you prevent cardiovascular disease.